Okay, Janet, we can get started.
Hi, everyone. Thank you for joining us. I am Janet Hill, the Chief Operating Officer at the Rock Island County Health Department. First off, we have no new cases in either Scott or Rock Island counties to report. We also are not prepared to answer questions regarding the Illinois announcement that is happening concurrently with this briefing. You are learning about this order as we are. With that, public health administrators from Scott and Rock Island counties are here to answer all of your other questions. To try to make this as efficient as possible, we ask that you type your questions in the chat box. The questions will be read by Brooke Barnes of the Scott County Health Department and answered to the best of their abilities by Ed Rivers, Director of the Scott County Health Department, and Nita Ludwig, Public Health Administrator in Rock Island County. Thank you. Ed, please continue.
Good afternoon. We've got a handful of topics to cover this afternoon, so let's get to it. First, we'll talk about self-isolation. As this pandemic continues, each of us is going to know someone with COVID-19, whether they have mild symptoms and are just staying at home, or they've been tested due to more severe symptoms. This may include someone in your own household. The CDC has provided recommendations for people who find themselves as the caregivers or household members of someone who is self-isolating. These recommendations can help to minimize the risk of spreading the virus. First, make sure you understand and can help the person with the directions of the healthcare provider related to medication and care. If you are remaining in the home to take care of a sick individual, stay in another room and use a separate bathroom if possible. Limit visitors who do not have an important need to be in the home. Help keep older adults or those who are at more risk away from the sick person. Make sure you have good airflow in shared spaces of the home. This includes perhaps an open window or other options. Wash your hands often with soap and hot water or use hand sanitizer. Avoid touching your eyes, nose, and mouth. Avoid sharing household items. Do not share dishes, drinking glasses, utensils, towels, beddings with anyone with symptoms or who are being evaluated for symptoms. Clean all frequently touched items like countertops, doorknobs, bathroom fixtures, toilets, phones, light switches, and other options. Read the labels of all cleaning products and use them as recommended. Wash laundry very thoroughly and wash anything with blood, body fluids, and other secretions right away. Monitor the individual symptoms. Be prepared to contact a healthcare provider if symptoms worsen. With the weekend approaching, people will be spending more time at home. Social distancing has been occurring in the workplace, should now carry over to home life. The question's been asked, should you visit your vulnerable, elderly, high-risk relatives? If the relative is located in a nursing home, retirement home, or long-term care facility, please stay away. If the relative lives at home, visitors should still be limited unless absolutely necessary, and good housekeeping practices and social distancing should be followed. Remember, although you may feel fine, you could still be carrying the virus and exposing others. Another question asked is, what if you are a caregiver for someone who is sick? As we said, stay in another room, use a separate bathroom if possible. If face masks are available, wear a face mask when you're around the patient. Avoid sharing household items like dishes, towels, bedding, etc., as we've said. Wash your hands after interacting with them. Monitor their symptoms and monitor your symptoms as well. And clean surfaces every day, as we said earlier. We've been asked about food safety with respect to COVID-19. We know that these uncertain times naturally cause each of us to figure out what's within our control. And we recognize that in preparing to stay home for longer periods of time, many of our citizens have stocked up on food supplies in the last week. We wanted to take a moment to remind you of good food safety guidelines. That best if used by date and other date labels are often confusing. Baby formula is the only product that is required to follow product dating. All other date labeling is established by the food manufacturer as a recommendation for highest quality. Shelf-stable food that does not require refrigeration or to be frozen is generally safe to eat after the recommended date. Most meat, such as chicken, beef, pork, etc., should be frozen and frozen guidelines followed. Even after opening, most milk and dairy products are good several days after the recommended date. If you planned ahead and froze food that was purchased, remember to thaw it safely before use. Thaw foods in the refrigerator, microwave, under running water, or other options, but not at room temperature. And remember, not let the internal temperature go above 41 degrees for longer than 4 hours. For foods that you may not have frozen, look for signs of food spoilage. These include texture change, sour smell, and discoloration. And remember to cook foods thoroughly. You can find safety preparation information on both the Scott and Rock Island County Health Department websites.
On the topic of food, we are seeing the support of our community is providing to the restaurant and food service venues in our community. We would like to provide you with the following reminders. Food and beverages may be sold as long as they are taken from the premises right away. Call or use an app to place your order ahead of time. Pick up your prepared food when it's ready. This keeps you from needing to linger in the establishment while your food is being prepared. Help our establishments comply with the requirements set by the governors. As we continue to focus on social distancing, please plan ahead. Call ahead to businesses and local governments to find out what work can be done over the phone or online. Again, social distancing is the best tool we have to help minimize the spread of this virus in our community. We have also been made aware of some fraud activities related to COVID-19. In the interest of social distancing, know that public health, healthcare, and other community partners will not be going door to door to share information or request information at this time. If you receive such a visit, call your local law enforcement agencies. Also, the CDC or public health agencies will not be calling you to reserve vaccines or other COVID-19 related items. So please let your law enforcement know if you receive such a call. We will continue to encourage you to help us drive home the recommendations about social distancing. While many of the public places where we find ourselves are not open, we still all need to do our part to minimize the spread of the illness. Dr. Katz recently shared why social distancing works. If you stay more than 6 feet away from other individuals, they cannot cough in your face and transmit the virus. That is basic droplet transmission. If you stay home or limit excursions outside the home, you will have less opportunity for someone to cough in your face and less opportunity to pick up the virus on your hands from someone who has coughed without good etiquette and contaminated the button on the elevator, for example. If you stay home when you have a cough, you will then not be the individual who soils the elevator button or cough near an older member of the community or someone with an underlying health condition. Larger gatherings give more opportunities to make a mistake and transmit than small gatherings. However, small gatherings still give more opportunities than no gatherings. Please help us all. Stay home when you're sick. call ahead to your provider if you begin to notice a fever, cough, or shortness of breath, and continue to wash your hands and cover your cough.
Okay, thank you both Nita and Ed. We did want to go to questions. It looks like we have one so far. Please put any questions that you have into the chat feature and we will get to those as they pop in. First question that we have, how do you respond to people who say COVID-19 isn't in Rock Island County? This is all an overreaction. Nita, you can speak probably to Rock Island County, but we could also speak generally to the community. Go ahead.
Sure. Well, what I would say is, while we have had no positive cases reported to us yet, we are still assuming, as everyone should be, that it is in our community at this time.
We have another question that I think you could both probably answer differently. How would you summarize this last week? Ed, what has this been like in the public health field?
It's been a very busy week. We've been going from teleconference to teleconference and issue to issue, trying to keep up. But I want to say that I'm very proud of our Scott County staff for pitching in and carrying the ball down the field, helping us prepare the community for the eventuality that we have more cases. I believe that is going to happen. And those who say that it's not in Scott and Rock Island County and it's all an overreaction and proceed without the precautions that we recommend are going to be that first case from a community member.
Nita, do you have anything to add in terms of the last week on your side of the river with your staff?
Well, I would echo the same sentiments as Ed. It's been very hectic, very busy. The public health workforce is the backbone of our community, and we have gotten frequently revised and updated guidance for just about everything and anything under the sun related to healthcare, and we've been keeping up on that. Our environmental health staff has been working out in the community to make sure all these bars and restaurants are compliant and that your food is safe to eat. So it's been a busy week, but we're all still doing everything that we normally do to keep the public safe.
Thank you, Nita. I think this was answered at the beginning. Any new cases in the Quad City area, they reported that there haven't been no new cases since we were on yesterday. Go to the next question. Are census workers going around neighborhoods yet? I think that may be closer to April 1st. Nita, I know you're connected in with the census. Can you answer that for us?
Right, and I do think there has been some guidance coming out for census takers, but again, we haven't gotten to the point where people are going door to door yet, so we'll keep an eye on that one.
Thank you. Has anyone been denied access to testing? Ed?
I'm not sure what the questioner means by denied, but there are criteria for testing, and based on those criteria, you may be provided a test and you may not be.
And that's by the healthcare providers, correct?
Yes, and the Iowa Department of Public Health in some cases.
If you have any access to Genesis, are there any numbers or an idea if the drive-through testing clinic has been utilized? I know for those of us who have been on the PIO meetings, we heard through their communication staff that they have had individuals come through. It sounds as if they're also testing for influenza as well as strep there. So they have been seeing some individuals there for those. I don't have exact numbers though. This was Brooke with the health department in Scott County. Question, if there is a confirmed case over the weekend, will there be a press conference? I don't know if we've talked about that as a group. Ed, do you want to address that? What the plan would be for that?
If we have a confirmed case this weekend, we will be collaborating with the Emergency Management Agency, who is our incident command infrastructure, and we will make an announcement about the availability of a press conference at that time.
Next question, we're still in the shortage phase of COVID-19 testing. How will we know when we're no longer in a shortage? Nita, do you have information on that?
I don't really have any information other than we have ordered tests through the public health system. Again, we're not sure if we're going to get what we've ordered or if we're going to get a partial amount to give out to like our community health care in our area. So I can't really speak to that right now.
Thanks, Nita. We had another question. For anyone who missed the beginning of the meeting, can you say and spell your names, please? We're going to type that into the chat, so hopefully that information will be there and available for you. We are aware of drive-through testing at Genesis and Community Healthcare. Are there others?
I'm not aware of any others at this time. Are there any in Rock Island, Nita?
I don't know that they've started yet, but Unity Point has had those conversations. So right now, the only ones operating that I know of for sure are the Genesis and Community Healthcare.
We'll give it another minute for any questions in the chat, so I'll go ahead and mute us, and then if anything pops up in the next minute, we'll grab the question. We do have a couple other questions here. With the Defense Production Act invoked to ramp up supply, will the health departments be involved as manufacturers shift over? Do you know of any businesses in the QC that will shift over? Ed?
We do understand it has been invoked but not implemented, so we don't have a good idea of what that might look like when it does. We did have one inquiry today on our submission line by a company that had been requested to continue operation for purposes related to COVID-19. They were just being a good citizen and letting us know that they were operating. But beyond that, we have no further information.
What messages do you have to workers on the front lines across the QC? Do you want to take that first, Nita?
What message would I have? I guess I would have a big thank you. I know they're all working very hard. We're getting, the patients who think they might have the symptoms coming in, and they're working very hard in those hospitals and emergency rooms and convenient care areas and community health care, and we just appreciate them all. We know they're working hard, and we just appreciate them.
Do you have anything to add to that, Ed?
I'd echo Nita's sentiment. This has been a very hectic week in both Scott and Rock Island counties, and everyone's been pitching in very hard. We appreciate everyone collaborating with public health and pushing this effort forward.
Thank you, Ed. This is Brooke. We have another question that popped up. Brooke with Scott County Health Department. Have the hospitals notified part-timers or retirees that they may be asked to help work shifts? What kind of planning are they doing to fill the need for workers? I know you're not with the health systems, Ed. Do you have anything to add to that question?
I have not heard any information on that directly.
Okay, it looks like that was our last question. Just to clarify, we have Ed Rivers and Brooke Barnes with the Scott County Health Department. Ed Rivers is the director. Brooke Barnes is the public information officer. We have Nita Ludwig, the public health administrator for the Rock Island County Health Department, and Janet Hill is the chief operating officer, for the Rock Island County Health Department. So again, we appreciate you being on this call with us and assisting us in getting out this information to the individuals in the community. We know that the self-isolation information will continue to be important as we move forward, as we see this come into the community and become much more than what we've seen. And we will anticipate not having these calls the next 2 days, and then we will be coming back and providing information again on Monday. We'll continue working as a group to determine how best to get you that information. So please just know that we'll be sending you out information coming soon. Thank you all for your diligence with this, and have a good weekend.